Hello and welcome to the Nurse Rosa's Insights podcast. I'm your host, Rosa Hart, and today I am joined by a nurse innovator, and I cannot wait to get to know her better, and you guys get to eavesdrop. So, this is Lisbeth Votruba, like Aruba. We were joking about going there together, but I might have been serious. So, if you see pictures later, you'll know where it started. So Lisbeth is the chief clinical officer. I wanted to say chief nursing officer, but chief clinical officer at AvaSure, which is a company that does a lot with virtual nursing. And so would you like to tell us a little bit about your current role, and then we'll get into your backstory?
Yeah, hi. Thank you so much for having me. Yeah, my role is Chief Clinical Officer because it does go virtual care in the acute care healthcare system does go beyond just nursing. But I am a nurse. I am a third generation nurse, and so my role is just to lead our clinically internally, and then externally. I am able to work with nursing professional organizations and do fun things like this. And I pinch myself because it's just who would have known when I went to nursing school that this would be the type of career I have.
Literally, this ain't your grandma's nursing.
Okay, I'm gonna have to do this here.
Oh,
Um,
is this your grandma and your
that's
mom?
my grandma and my mother
Oh,
and
and
me. Yes.
you. Oh, I love that so much. So for those of you who were not watching the video on YouTube, you're just going to have to go see the YouTube version because she just showed us the picture she has of her grandma graduating nursing school with the white hat and the white dress, and then her mom in the white hat and the white dress. And then I don't think you had the hat on in that picture.
No, I went to San Francisco State, which
Yeah.
is kind of a hippie school, so and it was 1994 or something like that.
Yeah.
So unfortunately, I didn't get a cap,
Well,
but
so
I they remind me of my legacy, and it's right on the wall in front of me. And also, I hope that technology gets us back to old-fashioned nursing. And that's
yeah.
kind of what they're there to remind me of too,
Mhm.
that technology needs to enhance the personalized hands-on nursing that they
Yes.
did. And so that's kind of counterintuitive, but that's my philosophy.
I absolutely love that. Before when I found out I got to interview you, I had to go back and listen to some previous interviews you did, and I heard you talking about that. It made my heart so happy because so many people are afraid of any technological advance because what they've seen is the cows or the the computers on wheels that get between you and the patient,
Right.
and all the monitors that give you alarm fatigue and make people want to hit the equipment.
Yes.
And so it really does take somebody with a vision to imagine where technology can give you back the humanity in nursing. And so I loved hearing that you are that kind of visionary leader. And I really want to thank you for all the work you have done in spearheading this because you've really been able to scale this up to like 1,200 different hospitals using virtual nursing now, right?
We provide virtual care. So AvaSure provides a intelligent virtual platform, and that blends. The goal is to blend virtual with the in-person care across the continuum with that. So we have virtual nursing and virtual sitting. So those the our customer base is a combination of that. Not all of them are doing virtual nursing yet. Virtual sitting
Okay.
is much more established as a standard of care and has been around a lot longer.
Yeah.
But virtual nursing has really come up since COVID.
Yeah, and when you're talking about virtual nursing, you're talking about a real human that's accessing the area of not an AI agent acting as a nurse, right?
Oh, don't if you know how to kind of get me angry is talk about, an AI agent imposturing as a nurse.
They only
You
do
know?
what they're told. It's not
Yeah.
their
I
Oh,
you
don't
know,
shoot
I
the messenger, right?
worked hard for my degrees, and there's just so much critical thinking that in the human element that has to go into nursing practice and the scope of practice. And so virtual nursing, and it's good to clarify that that it is a nurse leveraging technology, and AvaSure provides technology. We don't provide staffing.
Oh,
So it's the platform that would go in a patient room that, to simplify it, is the eyes and ears in
mhm.
a patient room. And
So
so
you don't staff the virtual nurse that's licensed in that state? That's an employee of the same organization that employs the in-person physical nurse at the bedside as well?
it could be, or we have partners
Ah,
as well that provide that, and we have some great partners that we work with, because some health systems want to outsource that.
mhm.
But at AvaSure, we're a software and technology company.
Gotcha.
So that's what we focus on, is the device. But the you know, it's all about the change management for it, and that's why, we have a chief clinical officer, and why we have almost 15% of our, team members are nurses. Um
15%, that's great.
yeah, yeah. So on the implementation piece and go live education and, post go live, we have nurses that are kind of holding your hand for the whole time, partnering, um, as well as you mentioned, Bree Laughlin. So we also have
Mhm.
nurses
Yes.
in our innovation and product management. So Bree Laughlin, and we might get into that, but
Yeah.
that's just, she's someone I really admired for a while, and so just earlier this year, Avasure was able to acquire her company, which is called Nurse Disrupted. So
Mhm.
she's a nurse entrepreneur,
Yes.
um, and that's been a wonderful experience. I'm a nurse intrapreneur, so I kinda have that the innovative,
Mhm.
um, bent to me, but um I didn't start my own company like she did.
Right? I mean, that's a whole other level of brave, and she
Yes.
describes it like it was inevitable. I had no
Yes.
choice. I had to do it. I saw this need, and I saw how to meet it, and I had to do it. And but there's a lot of risk there, and there's a lot
Yeah.
of bravery needed for that. So as much as she maybe doesn't toot her own horn, yeah, I very much admire her too. So we'll get
Yeah.
her on the podcast before long and talk about that. Um, but since you did acquire it, I know she was using kiosks for Nurse Disrupted. Is anything about the model changing or how what changed with the acquisition?
Yeah, so that acquisition just really helped us, to have, a presence across the continuum of care. We traditionally are more focused in brick and mortar, acute
Mhm,
care settings, and, so her solution expands out into ambulatory, and even some of the technology that we needed, or she helped move us forward into, like hospital at home,
mhm.
and this is also huge, it's just her expertise
Yeah.
and her network. And so, and it was fun for me. I Our CEO, let me be very involved, or and lead that kind of the vetting and that whole
Mhm.
process of, acquisition. So,
Oh, wow,
I
that's
learned a
it.
lot. Yeah.
Because as you've been scaling the virtual sitting and virtual nursing across the country, which are you international? Is it just across the US
In Canada.
and
Yeah,
Canada?
all 50 states.
Yes.
In
Hey, cool.
Canada.
Yeah. So as you've been scaling that, did you acquire any other similar businesses, or is Nurse Disrupted the first business you've acquired?
It is the second.
Oh,
And so when we look at the market right now and the needs and how virtual care is just how healthcare is provided, it's almost like we don't say online banking anymore. We just call it banking.
that's a
So
point.
virtual is just embedded in so many aspects. So we look at, kind of, builds by partner. So some of the aspects, much of it we have built ourselves. We have a huge team of developers, and we manufacture here in the United States. Um, and then we partner a ton. Um, so the partnerships are huge, and that's what nurses need too, is for the tech companies that they're working with to make sure we're integrated, we're interoperable. So we have very strong partnership with Epic, for example.
Mhm.
We're in the Epic Acute Virtual Care Toolkit Toolbox, I think they call it, and we want to use their blueprint, and that's the source of truth for where nurses are documenting and patient information. So there are many aspects that we're going to partner on. We're not going to try to do something that somebody else is already doing better. And then the other one is, when does it make sense to acquire? So we also acquired an AI company called Uva. I think that was last year, and they have some really interesting computer vision AI models.
You are gonna think I'm the corniest person ever, but I really just wanna sing "Ooh La La" now. You said "Ooh La." Like, I don't know what it is. I just
Artuba rhymes with Aruba, and Uva makes you think of ooh la la.
well, I'm a singer though, and so I was just at choir practice last night, and it's just I don't know, it's really got the creative side of my brain driving, and I may have heard you were musical too.
Yes, I'm a harpist.
Yeah, and you were gonna major in music in college?
Yeah, that was my goal. My As I showed you, my mom is a nurse, my grandmother's a nurse, and I said to myself, "I am not gonna be a nurse. I'm gonna do something different."
Both my kids said that, so what was what changed your mind? Because for me, it was I didn't wanna be a starving artist.
Oh,
What
yeah.
was it that did the made the difference for you?
I think I found out I'm kind of a mediocre harpist. And so it doesn't matter. You don't have to be that good to like have people be impressed. The instrument itself is really kind of dramatic and beautiful. But
If you wanna play at weddings every weekend for the rest of your life,
right,
right?
no, yeah, no.
It is
And
beautiful, though.
yeah. So while I was in school as a freshman, as a music major, I got my first job through my aunt, who's a nurse,
Mm.
and as a health unit coordinator in a OR. And I just kind of fell in love with the drama, of the excitement of and the nurses there. And I remember my mom picked me up because we were sharing a car because I was working my way through school. And I said, "Mom, I think I'm going to be a nurse." And
Was that your first day? Like, how far in?
no, 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 yeah, like a couple months into
A
it.
couple months, okay. Well, do you remember what surgery it was?
So I was the health unit coordinator. So there were 12 ORs and just all
Okay.
kinds of, surgeries, and I was babysitting surgeons' pagers and kind of running in and out, and I just loved it.
Yeah. See, I think for me, I was taking anatomy and physiology for fun in the summer. It was the summer between my junior and senior year in college, and I was on a music scholarship, so I was almost done.
Oh my
And
goodness.
but I got married and we were pregnant, and I wanted to take A&P so I could understand my body and my baby's body and be a better mom. And my grandfather had a heart attack that summer, and so I got to visit him in the hospital, and, well, I got to be there with after they did the PCI, and I got to go in the back and hold my grandma, while she's, like, very shook up, and while he showed us the images of how they had pulled this clot out of his heart, right?
Wow.
And I was like, "You can do that?"
Yeah.
And it just really made that whole anatomy thing a lot more exciting, and to see the impact that it had on him, and the doctor was like, "If you keep smoking, you're gonna undo everything I just did." And he was like, "If every year you don't smoke, you're gonna add 5 years to your life." And my grandfather quit smoking cold turkey after that. And so I think seeing that impact really made me wanna be part of it. I'm like, "Well, what else
Def
can you do in there?"
Love that.
Yeah. So, Yeah, but I wanted to say, once I found out you were musical as well, and then Bree is a musician. She is a
She's a
songwriter.
rock star.
I mean, obviously. But you know who else is a musician? Dr. Anthony Chang that founded AI Med.
Oh,
He wrote
wow.
he wrote a textbook on AI in medicine years ago, and he started this conference a decade ago, AI in medicine. Okay? He's a visionary. He's been working on AI since he was in med school. Like, I think he said 35 years ago. Don't tell him
Yeah,
I said too many years. But, but he was a musician. And I think that there is some correlation there because the musicianship, helps connect both sides of your brain. I remember when learning the piano, they said that, you know, learning to play the piano and learning the music and the technicalities of it, but also the expressiveness of it, um, really helped tie your creative and your analytical sides together.
that makes so much sense because I feel like nursing is an art and a science.
Mhm. And it really is. It really is.
Mhm.
And so let's see. When you are thinking about the future of virtual nursing and you're thinking about bringing the humanity back to care,
Mhm.
but using really high tech stuff. Is your vision anything like the medical bay in Star Trek?
Yeah, I love that. I used to love, especially actually the second generation one.
Yeah, Beverly Crusher, right?
Yes.
Uh,
Yeah, that's a great analogy of it. But I think maybe a little bit because you don't see a lot of clunky tech
right.
in between the caregiver and the patient there.
Mhm.
And so where we're at right now is like really high acuity virtual, computer vision and high acuity camera and it's audio too.
Mhm.
I think people think of virtual care and they think about the camera, a camera in the room,
It's watching me.
but the audio is maybe harder in some ways and so key as well and hard to get right. And so where we are right now, we have computer vision AI to predict what happens prior to a fall.
Mm,
There's audio AI out there that can hear if a patient's getting agitated and potentially getting violent.
mm.
Workplace violence is one of my kind of
Yes.
soapboxes. So that the audio is used on that. And then I think futuristically, I'm really excited about intelligent ambient documentation and just
Yeah.
kind of the the audio intelligence that can um, help take the conversation that a nurse is having and pull it into documentation. But then we need to learn how to nurse out loud. Uh,
Mhm.
that will be different for how we practice nursing. But
Mhm.
yeah, that's what I'm excited to see.
Oh, there is so much
Roll
here,
back.
and I wanna ask you about all of it at the same time. Um, but could you share with us an instance where the virtual nursing, either through the camera or the audio, has prevented some workplace violence?
Oh, all the time. All the time. I actually am kind of compiling data that we have on 9,000 incidents of workplace violence across, because we kind of collect data on that from our health systems.
Mhm,
And so, and I've published on workplace violence in the past from our data
mhm,
analytics and did a qualitative analysis
mhm,
of the types of verbal abuse that happens and the type of physical abuse that happens in patient rooms. And so, what I noticed from the data, which I'm just starting to analyze, that, and most of this is from virtual sitting, that 25% of the time that they're witnessing verbal or physical abuse, they're calling for help.
mm,
So that virtual person is calling a BERT, like behavioral emergency response team, BERT,
mhm,
or a code gray, which brings
mhm,
security and everybody to the room.
mhm.
It was
It's great.
just about a month ago, we were talking to a nurse leader who said the virtual sitter was watching a potentially violent patient and saw him trying to load his handgun. And
Did he have his handgun?
he did,
Why
and
did he have his
I don't know how that happened, but,
handgun?
I mean, not and so got security up there and, kind of on the situation before that turned into a newspaper headline.
Oh my gosh, that isn't okay, well, that's an example.
That's an
Uh,
example for you. That's not the only that and I have one that's not, like, so, devastating that, there was a patient who was confused and angry, and a lot of times it's dementia or in a fear,
yeah.
like, they don't know where they are. And he was standing behind a closed door with a bedpan over his head, waiting for whoever's going to come in next. He was just going to bang him over the head with the bedpan.
Oh, no.
So the virtual sitter just let the staff know, like, hey, don't go in there. And
Yeah.
so they waited till his arms got tired.
That's
And
awesome.
they went back to bed. And so, like, that was a non incident, and
That's awesome.
yeah,
Yes, that is a great case that's also prevention. So
prevention. Yeah.
and that's what we need to be all about. And
Yeah.
you were talking about ambient AI, and I got to circle back there. I got to moderate a panel at the health conference all about
Mm.
ambient AI for nursing documentation. And one thing that came out of that I really wanted to um, emphasize is I think nurses need to be verbalizing the value that they're bringing to the situation because we get so frustrated with people who don't know what we do. Well, if we were able to verbalize what we were doing, they would know. And when I was a clinical instructor or precepting, I was narrating what we were doing so that whoever I'm teaching would understand why, as well as how, and why we do it this way and not this other way. And so teaching the patient and the family is just as important because they need to know. Also, I worked on a neurocritical care unit, and so a lot of our patients were not able to speak. And so to, reduce their delirium, you need to let them know why you're doing things to them, that it is for them, for their own good, even though it may not feel good right now, so that they understand your intention. And the fact that that's not being done and the fact that we need to change practice is a good thing.
Yeah.
Like, that needs to happen, and so if AI makes us have to do it better, then that's great. Of course, there are some things you don't wanna verbalize in the room, and you will save to chart out lou at the nurse's station later. I'm sure you can think of some examples. But, yeah, memories.
Yeah, I have a friend who had a kind of a he was having a heart attack in urgent care, and he
Oh.
overheard the nurse calling report and said, I've got a moderately obese middle-aged man, and he's like, what? So yeah, that's what made me smile when you said that.
Yeah. Those things that you just need to be outside the room for accuracy. Yeah, not sensitivity. Well, you know what? I think this brings us to the $1,000,000,000 question, though. So, are you ready for this?
Yeah.
All right. Well, Lisbeth, if I gave you a grant for $1,000,000,000 to meet a need that you see in healthcare, how would you like to see it used strategically to have the most sustainable impact?
This came to me right away, and that is I would spend that on scholarships for graduate nursing programs. Because the big beautiful bill has just cut the loans for graduate nurses and put us in a category of non-professionals at the same time. I'm sure you're aware of that. And so I would love to try to offset that,
Yeah.
with not loans, but like
Yeah.
like
Cover
scholarships for
it. Yeah.
graduate nurses. And you automatically, of course, think about nurse practitioners, providing care, like, for example, rural settings where they're really needed or underserved. But I really liked what, Dr. Jennifer Menzik Kennedy, the president at the American Nurses Association, she said it in really simple language that the
Mhm.
lawmakers could understand. She said, that these post caps will stop nurses from going to school to be the teachers for other nurses. Hello. She didn't say hello. I just said
You
that.
said hello. Well,
But we need more nurses. We're not gonna get more nurses if we have no nurses to teach the nurses. So,
you're so right.
that's
And
what I would like to see.
I'm so glad to hear that. I've had several people on this podcast that have brought forward ways to support nursing and our profession overall. And honestly, that's why I started this
I love
podcast.
that.
I was listening to See You Now, and Shauna Butler did a little series on philanthropy in healthcare.
Yeah.
And they were talking about the $300 billion a year that is given in philanthropy to healthcare causes, and how only one penny of every dollar is given to nurses. I misspoke. It's $100 billion a year, because it's like one goes to nurses. And so the conversation for several episodes was, how can we use this strategically? What is the best strategic use for the one penny of every dollar that's given in philanthropy towards healthcare that is earmarked towards nursing related issues? Do we need to build a physical brick and mortar nursing school and put somebody's name on it? Is that what we need to do? We need to do what Lisbeth just said and invest it in educating nurses and empowering nurses to be educators. And I would dare say, set a standard for nursing educator pay, because to your point, if the problem with the loan caps is the professions that were not going to be able to access those higher loans, those professions are the ones who are the most likely to need federal loan forgiveness, because their career paths that they used to like get those degrees for, whether
Yes.
you're going into academia or to be a nurse practitioner, don't
Yeah.
pay enough to justify the student loans anyway.
Yes.
They're not going to be able to pay them off.
Yes.
So if the cost doesn't go down, you're going to have to just like donate these degrees,
Yeah.
because they're not going to pay for themselves either, no matter how
Women.
much Starbucks
Yeah.
those nurses give up to
Yeah.
afford their lifestyle.
Well said.
So thank you for saying that. I feel like that was a full circle moment to like the
Yeah.
birth of this podcast, for real.
Yeah. Oh, I love your story, Rosa.
Well, you know, we're all in this together, and I'm so
Yeah.
thankful to be on your team.
Thank you.
Yeah.
Same to
So
you.
if someone wants to reach out to you, where's the best place to connect with you? Is it LinkedIn?
I am a big LinkedIn person, and I am probably the only Lisbeth Votruba that I've ever seen. So
You
it's
are.
pretty
I
easy to
searched
find
for
me.
you. So as of today, you are. So, and then if people want to learn more about virtual nursing and AvaSure, where should they go? Should they go to the AvaSure website, or are
I
there any?
think AvaSure.com is a great place to look, and then we also have a YouTube channel,
Oh,
which a lot is our own partners, health system customers, like sharing their own success and lessons learned. So you can hear it from others instead of just hearing it from
yeah. Maybe we'll hear more bedpan stories.
us.
That was a good one. I'm going to keep that one. Yeah.
You're welcome.
Well, for those of you who are listening, or if you're watching on YouTube, if you've enjoyed this episode, please like it and follow this podcast so you'll get notified for the next episode. And if you know someone who has a great answer to the $1 billion question, point them my way so I can amplify their message, because we got to get these good causes out there so that investors or philanthropists can identify the most sustainable solutions to put their money into to build a better future for healthcare. If you want to follow me, I'm on all the social media platforms at Nurse Rosa Speaks. You can find me on my website, nurserosaspeaks.com, or on LinkedIn. I'll have those contact informations for Lisbeth as well as myself in the show notes. And I will see you in the next episode.
Thanks.